What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and testing negative for all those viruses that can make us sick. It is time now for the Thursday edition of the Virus Update for Thursday, December 11th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to be informed of what's going on with these viruses. That's what I do here on my channel each and every day. I give you the latest news, data, information, and anything I can find to keep you safe and informed. Want to stay informed? Just subscribe down below. Give this video a thumbs up, hit that notification bell, and share this video with anyone you know. Already, we have a ton of things to get through today. As you know, we have now entered the winter virus season, and the viruses clearly are going out of control, just like the thumbnail we used on many of our videos. Starting off today in the United States and North Carolina, we may be bouncing around a little bit here today. I tried to get everything organized, but we're going to start off in North Carolina and then just go from there. Seasonal respiratory illnesses increase in North Carolina, and you're probably wondering, well, it's increasing everywhere, but there's a reason why I like to include stories like this, because they include some important details which we need to keep track of. And in this case, it's deaths. They have had 3 new flu-related deaths in the past week, bringing the reported total for the season to 9. However, back in the 2024-2025 respiratory season, North Carolina reported 542 flu-related deaths, which was the highest number of statewide flu deaths recorded. So we'll have to see. They're up to 9 already. I got a feeling it's going to be pretty similar by the time we come down to the end of this season. Staying with North Carolina, Cone Health. This is a healthcare system in North Carolina. I know about this healthcare system. Cone Health updating mask and visitor policies with respiratory illness cases rising. Yes, Cone Health said it's changing its masking and visitor policies to keep patients and staff safe as respiratory illness cases rise in North Carolina. Children under 12 are not allowed to visit patients in Cone Health hospitals. Officials said exceptions will be made when necessary. Anyone feeling sick is asked to stay home to protect the vulnerable. So if you're coming to visit a patient but you're sick, sorry, you can't do that. Stay home. They're trying to limit the spread of illnesses. I mean, they deal with enough illnesses walking into the emergency rooms. Patients and visitors are encouraged, but not required, to wear masks. All Cone Health staff will wear masks when caring for patients. These changes took effect on Wednesday. Yeah, it's a sign of the times. Things are starting to get bad, and they don't want any unnecessary cases because, let's face it, staff gets sick. The hospital gets very overwhelmed with cases. There's a lot going on at this time. All right, moving on to this now. I believe we're in the UK for this story. This story should have been queued up with the UK. Okay, well, we'll roll with it. Kirkwall Grammar School, KGS, will be partly closed this Thursday and Friday after winter bugs and viruses have created severe staff shortages. So the combination of the viruses is causing there to be a problem. And as far as possible, the school will provide work online for affected pupils. So there you go. Over in the UK, they are dealing with school closings. Here in the United States, it's no different. We've been talking about several of them lately. Medford School cancels classes due to increased spread of norovirus. We've been wondering when there was going to be a norovirus outbreak. This is in the state of Massachusetts. The school says over 130 students were absent from class on Wednesday, with more students and staff members reporting upset stomach symptoms while in the school building. So, yes, schools are being canceled there. Now, moving over to this. Fayetteville High School notifies parents of whooping cough case. This is the 3rd one in the last month. Yikes, this is not good. It's never good to hear about whooping cough, and we've been hearing far too much about whooping cough this year. So yes, in accordance with guidance from the Arkansas Department of Health, they will notify parents and guardians each time a new diagnosis is received. And spoiler alert, yeah, I actually was scrolling down there to try and remember just what state this was in, because when you have as many news stories as today, sometimes it's hard to remember just what's going on. And silly me, look at that. It says Northwest Arkansas right there. But yes, they are dealing with another whooping cough case. This will make it into the school illness outbreaks because it's an illness that happened in a school and it made the news. All right, I did get this one right. I put this right after another news story about whooping cough. This time, Oregon. Whooping cough cases spike in Oregon, and get this, breaking a record from 1950. I mean, that's what, we're 2020. That's 75 years ago. Why are these things happening? Oh, we know why, but we fail to do anything about it. There's multiple different reasons, and they give excuses and this and that. COVID damaged immune systems, people not caring post-COVID. You would think with what we're learning from COVID, you would think people would be more aware, because there are studies saying, well, if COVID can do such and such, what can this virus do? But no one just seems to care anymore because they've lost a little bit of their life to having to try and prevent infections back in 2020. It's totally ridiculous. Oregon health officials said 22 infants have been hospitalized and one has died this year. Yikes, that's not good. There have been 1,475 reported cases of pertussis, also known as whooping cough, breaking the state's previous record set in 1950, which was 1,420, and probably back in those days, testing was not very easy. I don't know. 1950 was a long time ago. It was before my time. So, yeah, that's not a good record to be breaking. Moving on now to Connecticut. The Connecticut Department of Health confirms first measles case in more than 4 years. I believe their previous case was 2021. Yes, Connecticut does confirm a case. The case was confirmed in an unvaccinated child under the age of 10 from Fairfield County, Connecticut. Moving on, we have many more news stories. Utah County is reporting a new measles case. This is in Utah, and we do know that this region of the United States has been dealing with a severe outbreak of measles. There's been a few of them. There was one in Texas earlier in the year. That outbreak really slowed down. I don't know if they've missed any cases since then. Then we have the South Carolina outbreak that has gotten bad. But then there's this one, and I don't know which one's worse at the moment, whether it be upstate South Carolina or what's going on in part of the Four Corners region and north of the Southwest U.S., we'll just say, has been dealing with a really bad measles outbreak. So, yeah, not good for measles. And here we are. We're at, what is this, December 11th. This is going to carry right over into 2026. To be honest with you, I wouldn't be surprised if at this rate 2026 surpasses this year, because things are really increasing. I don't know if it's the cold weather that's drawing measles to go faster. I don't know, but take a look at this. U.S. exceeds 1,900 measles cases, and I do think at the rate we're increasing, the likelihood of us going over that national 2,000 count, it's probably going to happen. We know it's already happened. We miss cases. It's a real thing. There's people that refuse to get tested. There's people that say, oh, it's just mosquito bite. It's just this or that. And, yeah. It's probably already over 2,000. But the Centers for Disease Control and Prevention, CDC, said yesterday the United States has now gone over 1,912 measles cases, an increase of 84 in the last week. So the fact that we've now just increased 84 in 1 week, and we still have several weeks to go, yeah, it's going over 2,000. It's just going to happen. All right, moving on to that CDC measles page. Again, it's 1,912 cases, 43 jurisdictions. I don't think this includes the case in Connecticut, does it? Let's see here. Is Connecticut listed? No, I'm not seeing Connecticut listed, so we already know it's 1,913. Yeah, so already that number is wrong. Not good. All right, moving up to this. We have another measles report for you. Person contagious with measles reported at Fairview Medical Clinic. I believe this story is in Alberta. Yes, measles is still spreading up there. That Canada went above 2,000 measles cases long before we did. And now taking a look at this, Edmonton area schools coping with respiratory illness outbreaks. Respiratory expert says Usual symptoms are runny nose, sore throat, cough, and in some cases, upset stomach. So they're dealing with the same problems up there as well. And we might as well, let me just maneuver my tabs around here. We might as well take a look at the wastewater viral activity levels now in Canada. COVID-19 is moderate at this time. Flu A is high, Flu B is low, and RSV is now listed at high. So things are getting a bit worse now in Canada. Taking a look at this, we're going international, a little bit further away from North America. This time, we're going to go over to New South Wales, where a respiratory surveillance report is out for the week ending December 7th, 2025. Thank you so much, Dennis, the COVID info guy, for all the things that you post. The COVID positivity rate there is 2.5%, or down by 0.2%. Number of laboratories reporting COVID, 2 out of 4. COVID cases, that dropped, 711. That's down by 6.2%. However, we do run into a snafu, a problem. Influenza cases, mind you, it's summer there. 3,966, which is again up by 6.7%. Yeah, that's not good. We shouldn't be seeing them still rise, but we are. This new strain of flu, some news stories are calling it super flu. We're leaving out those stories. This new strain of flu really means business, and it's doing things we don't usually see. This is a very bad indicator for the rest of the world. RSV, 373 cases. That's down by 6.8%. Taking a look at the latest variants that are dominating for COVID there. XFG, 32%. PE, 1.4 is 24%, NB.1, 8.1, 20%, BA 0.3.2, 18%, and all others 6%. And we do see here that things are either stable or decreasing when it comes to COVID in wastewater. Already moving on. Okay, we already did this story, but didn't realize I put it up there twice. You have so many tabs, it gets confusing. This is in relation to the UK again. And let's take a look at the new update from the UK, shall we? It's not good. It's getting pretty grim over in the UK. Influenza. I mean, just look at this chart. It's going straight up, you know, kind of like a rocket. How a rocket goes straight up. Pretend this pen is a rocket ship. Yeah, that's the UK at the moment. Not good when it comes to flu. Let's dive in deeper, shall we? Take a look here. Hospital admissions per 100,000 people, 10.1. The overall positivity rate is 18.3%. However, we take a look at the ages 5 to 14, and that's gone even higher. 36.2% positivity rate for that age group. We also have this 15 to 44 years old is now up to 33% positivity rate. Yeah, that's not really good. The ICU number is going upward. Hospital admissions, everything at this point is just continuing to go up when it comes to flu in the UK. I'm not seeing a death count. Maybe that's on a different page. I do know they have a respiratory surveillance report. If I ever get the chance, it's the holidays, I will get around to taking a look at that. Trust me, once we hit Christmas Day on up until about New Year's, I usually give myself off from working. We're going to be updating everything that we're behind on during that period. I do got a few things going on during that time for a few annual traditions that I do, but when it comes to this, yes, we'll be making sure that we catch up on what we're behind with. All right, taking a look at this. This is RSV, positivity of people receiving a PCR test in England. 11.46% positivity rate now for RSV over there. So that's getting bad for the UK as well. Let's take a look at COVID. I was going to show you the website, but we got to do COVID real quickly because COVID is starting to go in the wrong direction. That drop has stalled and already. Yeah, look at this. Things starting to go back up. Cases, 709. That's up by 46. Deaths, 81. Hey, that's actually down by 21. That's good. And healthcare, that's up to November 30th. Hey, that's going up. Patients admitted. So that's telling me they're missing a lot of cases. 691 patients admitted. Let's come down and take a look at what's going on with the positivity rate. And I got a feeling, okay, my feeling was that it's starting to go up, but you can see here, it's not dropping very much. It's down to 2%. I don't know if it's going to drop much more than that, and we may be seeing some of these age groups probably starting to increase relatively soon. All right, taking a look at the website, there's a ton of things going on there. The tracking threads have been very active as of lately. I haven't gotten around to doing anything in there today. Maybe tonight. I'm sure there will be something I get into there. Got to go back out to work this afternoon. But yeah, things are really starting to go around and take a look at this. One part of Scotland brings back COVID-19 measures to combat rising flu cases. This is from Steve, and I would have to think masking may be part of that. Hey, if you want to read this story, datareport.info is my website. I have noticed there's only one way we can track how many people come to the website. It's through these ads. I hate running ads on the website, but I have noticed that website traffic is going up. So that's another indicator. These viruses are on the increase. Because when the viruses go up, traffic there increases, and traffic here on the channel does increase. All right, where do we want to go to next? We got to pause for that hydration break. 15 minutes in, and we're just now getting to the hydration break. Air qualities. Not as bad in the east today. There are still a few problems in the Midwest and California, Oregon, maybe parts of Washington and Western Canada still dealing with problems. Mostly California and Oregon. These reds, that's not good. That's just really bad air qualities. All right, moving on. Pinellas County, Florida. Oh boy, wow. We just refreshed this. Sick person. We're not going to count how many times it's there because we don't have time to do that, but there's a lot of sick person calls showing up there at this time. Maryland has been very busy. A lot of hospitals with look at this. Just four. There's four in a row right there showing up with fours. And we're seeing reroutes for ambulances showing up. Trauma bypasses. There are some ones, but the hospitals there are very busy. All right, Philadelphia yesterday, speaking of very busy, the busiest in a long time. 867 EMS incidents. And we were out all day yesterday. As you know, we did an Out in the Wild update. Probably could have done that today because today's a busy day as well. But yeah, there's a lot of ambulances. I saw several this morning. I saw several yesterday. I'm sure I will see more this afternoon. Briefly taking a look at Philadelphia. Flu activity continues to increase. This is behind. This goes back to November 30th. But influenza, the positivity rate, it is quickly starting to go up now in Philadelphia, which is following what's going on in the rest of the state of Pennsylvania. EMS calls in Montgomery County. Only 13 right now. Before I started this video, it was at one point over 20, so a little bit better right now. Taking a look at what's going on in Chester County, Pennsylvania, and we will see that Chester, well, we got to refresh this again. Chester County, Pennsylvania is fairly busy right now. Oh my, dead on arrival in West Brandywine Township, sick person, and a few other things showing up at this time. Bucks County has been busy today. We'll see if that's still the case. Yeah, still is. Respiratory distress, just a whole bunch of things going on there. Taking a look at what's going on with the hospital situation in Pennsylvania. Does show we have a few hospitals with problems, but again, I suspect there is a lot of data on this page that is not getting updated anymore, like the Lehigh Valley. There's been no hospitals with problems. That can't be right. I think that's wrong at this point. Taking a look at what's going on with the hospital situation in the state of New Jersey. Central State Medical Center, critical care issue. Inspire Center, Mannington, specialty issue. And we also see a psychiatric issue at University Hospital at this time. Taking a look at what is going on in New York State, and we do see that they have 625 new cases reported. And taking a look at the hospital situation, admissions there do continue to go up in the state of New York. 367 hospital admissions have been reported this week, so that is higher than the previous count. Taking a look at some wastewater data now, shall we? And I do have some bad news for you. COVID on wastewater scan is now listed at high in the Northeast, the Midwest, and the Southeast. It is, however, still listed in the low category on the West Coast. That is some good news to report. And then taking a look at norovirus. A little bit of good news here. The Midwest did go down to medium, but the Northeast, the South, and the West Coast is still listed at very high, or I should say high, when it comes to norovirus at this time. All right, let's do a couple individual wastewater sites. Let's go to Snohomish, Washington. I don't believe we did enough data for there so lately, so let's see what's going on. Snohomish, Washington. Low for measles, COVID. RSV is starting to go up. Influenza A. That still says low, but look at that value. 100 pathogens detected. Yeah, that's going upward at this time. That's trending in the wrong direction. That's going to either be medium or high relatively soon. I wish we could see in wastewater scan, and maybe it'll come in the near future, pertussis. I wish we could see whooping cough. Look at this. Utah, high influenza A. Idaho. California has some high areas. That's not good. Can we take a look at San Diego? No, we can't do San Diego because it is grayed out at this time. Let's go down to somewhere in the south. How about we take a look at what is going on in Miami, Florida? This is the southern wastewater site there. COVID quickly starting to go up. RSV is high. Influenza A is high. Norovirus is high. Yeah, not good. And to be fair, we will go up to the Northeast and the Midwest. Let's take a look at what's going on in Bridgewater, New Jersey, where COVID is quickly starting to go upward. Influenza A is now listed high and going upward. RSV is going upward. Norovirus, hey, that's medium. Medium's better than high. And now let's take a look at what's going on somewhere in the Midwest. How about we take a look at what's going on in Warren, Michigan? We'll end you here today. And in Warren, Michigan, COVID is now listed at high. Whoa, influenza A is really high. Wow, that is going way upward. Influenza B is low. Norovirus is high, and that's continuing to go up as well. Everything else is okay. But wow, that was a busy virus update, wasn't it? Yeah, these viruses are causing, so many disruptions right now. And it is only going to get worse, especially here in the United States. Hopefully in a few weeks we will see the UK peak for flu, probably just after Christmas. But here's the problem with that. They're getting hit really hard in the hospitals there with flu, and COVID is just now starting to go up again. Meanwhile, at the start of their flu, or at the onset of their flu wave, COVID was just finally starting to get low again. You just can't win, can you? Alrighty, folks, if you enjoyed today's long virus update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. If something triggered a thought, which, with all the things we showed today, I imagine something's probably triggering a thought in your mind. Leave a comment about it down below. I'll try and catch up on these comments and tracking threads on my website. I'll do the best I can. You can also support the channel down below. Alrighty, folks, see you again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Thursday afternoon. Thanks for watching.